Hi, I'm Dr. Sam Dubé. I'm here to talk to you today about iliotibial band, also known as IT band syndrome, its symptoms, the underlying cause, and the benefits of different treatment options. The symptom of iliotibial band syndrome is pain in the outer region of the leg, from the hip to the knee. Pain may also be experienced at the outer hip or the outer knee or anywhere in between, or throughout the entire length of the IT band. The iliotibial band is a fibrous band that connects our pelvis to the tibia and knee fascia. What causes iliotibial band syndrome? Well, most IT band pain is the result of acute or chronic maladapted neuromuscular function. Acute functional problems occur when the body is pushed beyond its everyday functional capabilities. Chronic functional problems occur gradually when everyday activities don't promote healthy function. Often, there is no pain or discomfort until the stress-related tissue damage builds until movement is impeded. In either case, most IT band-related functional problems occur because of poor or maladapted neuromuscular function throughout our feet, legs, and hips. There is a direct biomechanical relationship between foot function and the way the legs and the hips function. An unstable foot with a poorly functioning arch system will create poor bone alignment and imbalanced muscle throughout the legs and hips. Over time, this function becomes the norm, creating repetitive strain and stresses throughout, and the IT band thickens and painfully inflames. For proper function, our feet require the right stimulus and the right movement. Right stimulus consists of the subtle, varied stimulus that the soles of our feet receive when we walk, especially when we walk barefoot on natural terrain. With each step, there are subtly different sensations. These subtle differences in stimulus keep our brain on high alert so that our body's protective reflexes function properly with optimum muscle function. When our brain is uncertain about what will happen, it triggers protective reflex muscle activations that support our arches even before our feet contact the ground to ensure that our feet and legs can safely manage the forces generated by the activity intensity of our bodies. As activity-related stimulus intensifies, a progressively higher arch is created. That's why, when they're functioning properly, our arches and toes rise and fall dynamically in response to the varying activity stimulus intensities. This uninhibited dynamic movement is right movement. Right stimulus and right movement prevent the creation of repetitive strain on the IT band, which is caused by imbalanced muscle function. This contributes to collapsing arches and poor bone alignment and imbalanced muscle use throughout the legs and hips. Conventional footwear impairs optimal foot function in two ways. First, most conventional footwear dampens right stimulus. This is particularly true for shoes or insoles that support or cushion our feet. They spread the forces evenly across the soles of our feet, creating a sensory input that's muted and repetitive, step after step. Within a short period of time, our brain tunes out the stimulus and stops responding to it. As a result, our brain doesn't sufficiently activate the muscles that stabilize our arches and properly align our feet, legs, hips, and lower back before our feet contact the ground. This tuned out brain response is actually quite natural and happens all the time. The same thing happens when we walk into a room and first smell the coffee. Then after a few minutes, we don't notice the smell at all. Second, most conventional footwear, especially footwear that's tightly laced, has snug toe boxes or stiff midsoles or outsoles, restricting the right movement dynamic raising of the arches and toes that is just so critical in the creation of a strong, stable arch system and healthy linear propulsion with the toe-off forces spread across the forefoot. Impaired right stimulus and right movement increase the strain and damaging stresses on the IT band. Conventional treatment methods for iliotibial band syndrome include the following: therapeutic exercise, supportive products such as orthotics, taping and bracing, foam rolling, massage, and injections. Now, while these methods may temporarily alleviate symptoms, they don't address the poor neuromuscular function that is the real cause of the problem. In fact, the more we artificially support or cushion our feet, the weaker and the more dependent we become on these types of products. These old school support and cushioning treatment methods are not recommended in any other area of musculoskeletal medicine as a viable long-term treatment option. In fact, today's modern treatment methods for poor neuromuscular function focus on increasing mobility, muscle strength, and proper alignment via proper technique exercise, which requires both right stimulus and right movement. Science has shown that simply challenging the body to do its job is the best way to restore and enhance function. This principle is the foundation for virtually all of today's sports training and rehabilitation programs. To address the poor neuromuscular function that causes iliotibial band syndrome and prevent it from recurring, I recommend the following. Walking barefoot on natural terrain as much as possible. This provides the optimal right stimulus and allows for the right movement required for healthy neuromuscular function. To obtain right stimulus in your conventional footwear, use BioPods stim soles. For best results in conventional footwear, use BioPods stim soles in loosely laced, soft, flexible footwear that allows your arches and toes to rise easily. For optimal neuromuscular function while wearing shoes, use BioPods footwear, which are specifically designed to provide the right stimulus and facilitate the right movement that optimize and encourage healthy foot, leg, hip, and back function. Remember to consult with your healthcare practitioner and ask them about employing soft tissue mobilization therapies to address the fibrotic scar tissue that may have formed in the past.